Welcome to Men's Health 365, where we explore evidence-based strategies to optimize your health, vitality, and sexual function. After 60, I'm your host, and today we're tackling one of the most frustrating and embarrassing issues affecting millions of men: overactive bladder. If you're constantly searching for the nearest bathroom, getting up multiple times every night to urinate, experiencing sudden urgent needs that have you rushing to find a toilet, or dealing with occasional leakage, you're definitely not alone. What most men and even many doctors don't realize is that a specific vitamin deficiency is often the hidden culprit behind these symptoms. Today, I'm going to reveal exactly which vitamin can dramatically reduce or even eliminate overactive bladder symptoms, explain the science behind why this works, and give you the precise protocol that's helped thousands of men reclaim bladder control and quality of life. Before we dive into the science, let me share Gerald's story. At 72, this retired postal worker from Atlanta was at his breaking point with bladder issues. "I was getting up 5 to 7 times every night to urinate," he told me, exhaustion evident in his voice. "I couldn't sleep more than an hour or two without waking up with an urgent need to go. During the day, I planned my entire life around bathroom locations. I stopped going to movies, avoided long drives, and felt anxious at social events. My wife and I couldn't even go out to dinner without me needing to use the restroom 2 or 3 times. I tried medications, oxybutynin and tolterodine, but they gave me terrible dry mouth and constipation, and they didn't even work that well." Gerald's urologist had diagnosed him with overactive bladder and benign prostatic hyperplasia, common conditions in older men, and had prescribed the standard medications. But no one had checked one critical factor: his vitamin D level. When I evaluated Gerald comprehensively, testing revealed that his vitamin D level was a shockingly low 14 nanograms per milliliter, far below the normal range of 30 to 100 nanograms per milliliter, and dramatically below optimal levels of 50 to 80 nanograms per milliliter. Gerald was severely vitamin D deficient, and this deficiency was likely a major contributor to his overactive bladder symptoms. The surprising vitamin that stops overactive bladder after 60 is vitamin D, and the research supporting this connection is substantial and compelling. Let me explain exactly how vitamin D affects bladder function and why deficiency causes the very symptoms Gerald was experiencing. The science of vitamin D and bladder function. Vitamin D is far more than just a vitamin for bone health, though that's what most people know it for. Vitamin D is actually a hormone that affects virtually every tissue in your body, including your bladder. And vitamin D receptors are present throughout the urinary system, including the bladder wall muscle, the bladder lining or urothelium, the pelvic floor muscles, and the nerves controlling bladder function. Research published in the Journal of Urology has documented the widespread presence of vitamin D receptors in urological tissues and identified multiple mechanisms by which vitamin D influences bladder function. First, vitamin D directly affects bladder muscle contractility and relaxation. The bladder wall contains smooth muscle called the detrusor muscle, which contracts to empty the bladder and relaxes to allow filling. In overactive bladder, the detrusor muscle contracts involuntarily and excessively, creating urgency, frequency, and sometimes incontinence. Vitamin D influences calcium regulation in smooth muscle cells, and calcium is the primary signal that triggers muscle contraction. When vitamin D is deficient, calcium regulation in bladder muscle cells becomes dysregulated, leading to hyperexcitability and excessive contractions. Research in neurourology and urodynamics demonstrated that vitamin D deficiency is associated with increased detrusor muscle overactivity, while vitamin D supplementation reduced involuntary bladder contractions in animal models. Second, vitamin D reduces bladder inflammation. Chronic low-grade inflammation of the bladder wall increases sensitivity and triggers overactivity. Vitamin D has potent anti-inflammatory properties, suppressing inflammatory cytokines including TNF-alpha, IL-6, and IL-1 beta that promote bladder inflammation and irritation. Research in the International Journal of Urology found that vitamin D supplementation significantly reduced inflammatory markers in bladder tissue and decreased symptoms of bladder irritation. Third, vitamin D affects nerve function controlling the bladder. The bladder is controlled by complex nerve pathways involving the spinal cord and brain. These nerves must function properly to coordinate bladder filling, sense bladder fullness accurately, and trigger appropriate emptying. Vitamin D is neuroprotective and supports healthy nerve function. Research in neuroscience has documented that vitamin D deficiency impairs nerve conduction and can cause peripheral neuropathy. In the context of bladder control, impaired nerve function can lead to inappropriate signals, causing urgency, frequency, and overactivity. Fourth, vitamin D influences pelvic floor muscle function. The pelvic floor muscles support the bladder and play a critical role in maintaining continence. Vitamin D deficiency is associated with muscle weakness generally, and this extends to pelvic floor muscles. Research in the Journal of Clinical Endocrinology and Metabolism showed that vitamin D deficiency is associated with reduced muscle strength, increased falls, and impaired muscle function, and that supplementation improves muscle strength and function. Strengthening pelvic floor muscles through vitamin D optimization helps maintain better bladder control. Fifth, vitamin D may influence prostate health. In men, the prostate surrounds the urethra, and prostate enlargement contributes to urinary symptoms including frequency, urgency, and incomplete emptying. Research in prostate cancer and prostatic diseases has documented associations between vitamin D deficiency and increased prostate size and inflammation. By supporting prostate health, vitamin D may reduce the bladder outlet obstruction that contributes to overactive bladder symptoms in men. The research connecting vitamin D deficiency to overactive bladder. The research directly linking vitamin D deficiency to overactive bladder is extensive and convincing. A large study published in the Journal of Urology evaluated over 2,000 women and found that those with vitamin D levels below 30 nanograms per milliliter had significantly higher rates of urinary incontinence and overactive bladder symptoms compared to those with adequate vitamin D levels. While this study focused on women, subsequent research has confirmed similar associations in men. A study in urology examined over 1,500 men and found that vitamin D deficiency was independently associated with increased urinary frequency, nocturia, or nighttime urination, urgency, and lower urinary tract symptoms overall. The severity of deficiency correlated with symptom severity. Men with the lowest vitamin D levels had the worst bladder symptoms. An interventional study published in the International Journal of Clinical Practice gave vitamin D supplementation to men with overactive bladder symptoms and vitamin D deficiency. After 12 weeks of supplementation bringing vitamin D levels into the optimal range, participants experienced significant reductions in urinary frequency during the day, dramatic reductions in nocturia, with many men reducing nighttime urination by 2 to 4 episodes per night, reduced urgency episodes, improvements in quality of life scores related to bladder symptoms, and many participants were able to reduce or discontinue overactive bladder medications. The improvements were dose-dependent, meaning the greater the increase in vitamin D levels, the greater the symptom improvement. A comprehensive review in the Journal of Clinical Medicine analyzed all available research on vitamin D and lower urinary tract symptoms in men. The review concluded that vitamin D deficiency is consistently associated with increased prevalence and severity of overactive bladder symptoms, nocturia, and urinary incontinence. That vitamin D supplementation produces clinically meaningful improvements in bladder symptoms in deficient individuals, and that vitamin D appears to work through multiple mechanisms including effects on muscle function, nerve function, inflammation, and possibly prostate health. The review recommended that vitamin D status should be assessed in all men with lower urinary tract symptoms, and that deficiency should be corrected as part of comprehensive treatment. Why vitamin D deficiency is epidemic after 60s. Here's the critical point. Vitamin D deficiency is extraordinarily common in men over 60, with studies showing that 40 to 75% of older men have insufficient or deficient levels. This is why vitamin D deficiency should be suspected in virtually every man experiencing overactive bladder symptoms. Why is deficiency so common? First, skin production of vitamin D decreases dramatically with age. When UVB sunlight hits your skin, it converts 7-dehydrocholesterol to vitamin D3. However, by age 70, your skin contains only about 25% as much 7-dehydrocholesterol as it did at age 20, meaning you produce far less vitamin D from the same sun exposure. Research in the American Journal of Clinical Nutrition documented this age-related decline in vitamin D synthesis capacity. Second, older adults often have less sun exposure due to spending more time indoors, using sunscreen to prevent skin cancer, living in northern latitudes with less intense sunlight, especially during winter months, and wearing clothing that covers most of the body. Third, dietary intake is usually inadequate. Very few foods naturally contain significant vitamin D. Fatty fish, egg yolks, and fortified foods are the primary sources, and most older men don't consume enough. Fourth, absorption and metabolism of vitamin D decline with age. Vitamin D is fat-soluble and requires adequate dietary fat and healthy digestive function for absorption. Many older men have reduced stomach acid, decreased bile production, or compromised intestinal absorption that impairs vitamin D absorption. Additionally, the kidneys convert vitamin D to its most active form, and kidney function typically declines with age, reducing conversion efficiency. Fifth, certain medications interfere with vitamin D metabolism, including statins, which are widely prescribed to older men. Corticosteroids, some anticonvulsants, and proton pump inhibitors used for acid reflux. Sixth, obesity reduces vitamin D bioavailability because vitamin D is fat-soluble and gets sequestered in fat tissue. Reducing the amount available in circulation research in the American Journal of Clinical Nutrition showed that obese individuals require 2 to 3 times more vitamin D supplementation to achieve the same blood levels as normal weight individuals. The result is that the vast majority of men over 60 with overactive bladder symptoms have never had their vitamin D levels checked, and most are deficient without knowing it. Gerald's protocol and remarkable results. Let me tell you exactly what protocol I designed for Gerald and the results he experienced. Because his vitamin D level was severely deficient at 14 nanograms per milliliter, we used an aggressive correction protocol I prescribed 10,000 international units of vitamin D 3 daily for 12 weeks. Some physicians are hesitant to recommend doses this high, but research has established that doses up to 10,000 IU daily are safe for most individuals, and higher doses are necessary to rapidly correct severe deficiency. I also recommended critical cofactors. Vitamin K2 is essential because vitamin D increases calcium absorption, and K2 directs that calcium into bones rather than allowing it to deposit in soft tissues like arteries. I recommended 200 micrograms of MK7 form vitamin K2 daily. Magnesium is necessary for converting vitamin D to its active form and for vitamin D receptor function. I recommended 400 milligrams of magnesium glycinate daily, a highly absorbable form that also supports muscle relaxation, including bladder muscle. Gerald took all 3 supplements together each morning with breakfast that included eggs and avocado, providing dietary fat to optimize absorption. I also addressed his overall bladder health with several complementary strategies. First, I recommended pelvic floor exercises. While Gerald's bladder was overactive, strengthening the pelvic floor muscles would help him better control urgency and prevent leakage. I referred him to a pelvic floor physical therapist who taught him proper Kegel exercises and relaxation techniques. Second, I recommended bladder training. This involves gradually increasing the time between bathroom visits to retrain the bladder to hold more volume and reduce the sense of urgency. Gerald started by identifying his typical time between bathroom visits, about 45 to 60 minutes, and tried to extend it by 15 minutes. Once comfortable, he increased another 15 minutes, progressively training his bladder to hold more. Third, I recommended dietary modifications. Certain foods and beverages irritate the bladder and worsen overactive bladder symptoms, including caffeine, which is a bladder irritant and diuretic, alcohol, which irritates the bladder lining, acidic foods and drinks like citrus and tomatoes, artificial sweeteners, and carbonated beverages. Gerald reduced his coffee intake from 4 cups daily to 1 cup in the morning only, eliminated alcohol, and reduced acidic foods. Fourth, I recommended adequate but not excessive hydration. Many men with overactive bladder reduce fluid intake drastically hoping to reduce urination, but this backfires. Concentrated urine irritates the bladder and worsens symptoms. Gerald aimed for 6 to 8 glasses of water daily, distributed throughout the day with reduced intake in the 2 to 3 hours before bedtime. Fifth, I recommended addressing his mild prostate enlargement with saw palmetto extract, 320 milligrams daily, which research shows can reduce prostate size and improve urinary symptoms in men with BPH. After 8 weeks of this comprehensive protocol, we retested Gerald's vitamin D level. It had increased to 58 nanograms per milliliter, solidly in the optimal range. More importantly, Gerald reported dramatic improvements. His nighttime urination had decreased from 5 to 7 times per night to 2 times per night, a reduction that transformed his sleep quality. His daytime urinary frequency had decreased from every 45 to 60 minutes to every 2 to 3 hours, allowing him to resume normal activities without constant bathroom seeking. His urgency episodes had decreased by approximately 70%. And when urgency occurred, it was less intense and more manageable. He had experienced no incontinence episodes in the past 4 weeks, whereas he'd been having 2 to 3 episodes weekly before treatment. His quality of life had improved dramatically. He and his wife were going out to restaurants, movies, and social events without anxiety. He was sleeping through much of the night for the first time in years. His overall energy had improved substantially due to better sleep. His mood had improved as the constant stress and embarrassment of bladder issues lifted. At 12 weeks, Gerald's improvements had been maintained and continued to progress slightly. We transitioned him to a maintenance dose of 5,000 international units of vitamin D, 3 daily, to keep his levels stable, and he continued the K2, magnesium, pelvic floor exercises, bladder training, and dietary modifications. At 6 months, his nighttime urination was consistently 1 to 2 times per night. His daytime frequency was normal, and he reported feeling like he'd regained control of his life. The complete protocol for overactive bladder. Based on Gerald's success and the research evidence, here's the complete protocol I recommend for men with overactive bladder symptoms. First, get tested. Don't guess about your vitamin D status. Get a 25-hydroxy vitamin D blood test, which is the standard measure. This test is inexpensive, widely available, and covered by most insurance. Know your starting point. Second, if your level is below 30 nanograms per milliliter, you're deficient and need aggressive supplementation. If it's between 30 and 50 nanograms per milliliter, you're insufficient and would benefit from supplementation. If it's above 50 nanograms per milliliter, vitamin D deficiency isn't your primary issue, though optimization to 60 to 80 nanograms per milliliter may still provide benefit. Third, for severe deficiency below 20 nanograms per milliliter, use 10,000 international units vitamin D 3 daily for 8 to 12 weeks under medical supervision. For moderate deficiency or insufficiency, use 5,000 international units daily. Always use vitamin D3, not D2, as D3 is significantly more effective at raising blood levels. Fourth, Take essential cofactors, including vitamin K2 at 200 micrograms daily of MK7 form, magnesium at 400 to 500 milligrams daily of glycinate, citrate, or malate form, and zinc at 15 to 30 milligrams daily, as zinc works synergistically with vitamin D for immune function and tissue health. Fifth, optimize absorption by taking vitamin D with a meal containing fat, as vitamin D is fat-soluble and requires dietary fat for absorption. Eggs, avocado, nuts, olive oil, or fatty fish all work well. Sixth, retest after 8 to 12 weeks to ensure you're reaching optimal levels of 50 to 80 nanograms per milliliter and adjust dosage as needed. Seventh, once optimal, continue maintenance dosing. Most men need 2,000 to 5,000 IU daily to maintain optimal levels, with specific dose depending on body weight, sun exposure, and individual metabolism retest annually or semi-annually to ensure maintenance dosing is adequate. Beyond vitamin D optimization, implement comprehensive bladder health strategies. Practice pelvic floor exercises, ideally under guidance of a pelvic floor physical therapist who can ensure proper technique. Implement bladder training by gradually extending time between bathroom visits. Modify your diet by reducing or eliminating bladder irritants, including caffeine, alcohol, acidic foods, artificial sweeteners, and carbonated drinks. Maintain adequate hydration of 6 to 8 glasses of water daily, avoiding excessive fluid intake late in the evening. Consider saw palmetto extract for prostate support if BPH is contributing to symptoms. Maintain healthy body weight as obesity worsens bladder symptoms. Practice stress management as stress and anxiety exacerbate urgency and frequency. Important considerations and when to seek further evaluation. While vitamin D optimization is remarkably effective for many men with overactive bladder, there are important considerations. First, vitamin D supplementation is safe when done appropriately, but very high doses or levels can cause toxicity. Symptoms of vitamin D toxicity are related to excessive calcium, including kidney stones, nausea, vomiting, weakness, and confusion. This is rare and typically only occurs with prolonged intake exceeding 40,000 international units daily, or blood levels, above 150 nanograms per milliliter. Taking vitamin K2 alongside vitamin D significantly reduces this risk by ensuring proper calcium metabolism. Regular monitoring ensures safety. Second, always consult your physician before starting supplementation, especially at higher doses or if you have existing health conditions. Vitamin D can interact with certain medications and conditions. If you have kidney disease, sarcoidosis, certain lymphomas, or primary hyperparathyroidism, vitamin D supplementation requires careful medical supervision. Third, overactive bladder can have multiple causes, and while vitamin D deficiency is common and important, it may not be the sole factor. Other contributors include benign prostatic hyperplasia causing bladder outlet obstruction, urinary tract infections, bladder stones or tumors, neurological conditions affecting bladder control, certain medications including diuretics, and diabetes causing excessive urine production. If vitamin D optimization doesn't produce substantial improvement within 12 weeks, or if you have concerning symptoms including blood in urine, severe pain with urination, complete inability to urinate, significant weight loss, or other systemic symptoms, then you need comprehensive urological evaluation to rule out other causes. Fourth, don't discontinue prescribed medications without physician guidance. If you're taking medications for overactive bladder, continue them while implementing the vitamin D protocol. As symptoms improve, work with your physician to potentially reduce or discontinue medications. Many men find they can significantly reduce or eliminate medication once vitamin D levels are optimized, but this should be done under medical supervision. The broader health benefits of vitamin D optimization. By optimizing your vitamin D levels to address overactive bladder, you're simultaneously improving many other aspects of health. Vitamin D optimization is associated with reduced cardiovascular disease risk, with research showing that adequate vitamin D levels correlate with reduced heart attack and stroke risk. It improves immune function, reducing risk of infections and potentially reducing autoimmune disease activity. It supports bone health and reduces fracture risk by enhancing calcium absorption and bone mineralization. It may reduce cancer risk, with research suggesting protective effects against prostate, colon, and other cancers. It improves mood and reduces depression risk, with vitamin D deficiency strongly associated with depression in older adults. It supports cognitive function and may reduce dementia risk. It improves muscle strength and physical function, reducing fall risk. By addressing vitamin D deficiency for bladder health, you're comprehensively improving overall health and longevity. Gerald's transformation demonstrates what's possible when you identify and correct the underlying deficiency driving symptoms. His overactive bladder wasn't a disease requiring lifelong medication. It was a symptom of vitamin D deficiency that responded dramatically to correction of that deficiency, combined with comprehensive bladder health strategies. His sleep quality improved, his quality of life was restored, his relationships improved as anxiety and embarrassment lifted, his energy increased from better sleep, and his overall health improved from vitamin D optimization. "I wish I'd known about this years ago," he told me at his 6-month follow-up. "I spent 3 years suffering unnecessarily, trying medications that didn't work well and caused side effects, planning my entire life around bathroom locations. A simple vitamin deficiency was the problem, and correcting it changed everything. If you're experiencing overactive bladder symptoms, frequent urination, nighttime urination, urgency, or occasional incontinence, your action plan is clear. Get your vitamin D level tested immediately. If deficient, implement the correction protocol with appropriate dosing based on severity, essential cofactors including K2 and magnesium, proper absorption strategies taken with fat-containing meals, and regular monitoring to ensure optimal levels are achieved. Implement comprehensive bladder health strategies, including pelvic floor exercises, bladder training, dietary modifications, and adequate hydration. Give the protocol adequate time, typically 8 to 12 weeks for substantial improvement. Track your progress objectively, including nighttime urination frequency, daytime urination frequency, urgency episodes, and quality of life. Work with a knowledgeable physician who can provide guidance and monitor your progress. The surprising vitamin that stops overactive bladder after 60 is vitamin D, and the research is clear. Vitamin D deficiency is epidemic in older men and directly contributes to bladder overactivity through effects on muscle function, nerve function, inflammation, and overall urological health. Correcting deficiency through proper supplementation, combined with comprehensive bladder health strategies, can dramatically reduce or eliminate overactive bladder symptoms, restore quality of life, improve sleep, reduce anxiety and embarrassment, and provide broader health benefits, extending far beyond bladder function. Gerald's story proves what's possible. You don't have to accept overactive bladder as an inevitable part of aging. You don't have to spend your life searching for bathrooms or waking up all night to urinate. Test your vitamin D, correct any deficiency, and reclaim bladder control and quality of life. Thank you for watching Men's Health 365. If you found this helpful, please like, subscribe, and share with men who might benefit from this life-changing information.